All right, so real quick, I did a live video the other day with some like back pain, some good stretches for the hip flexors through the abdomen area, and then I wanted to continue on like back pain and hip pain, because I know it's a big problem. You know, a lot of people I talk to, and it seems like there's really like a simple fix for it. So what I wanted to show you is another muscle that's kind of hard to hit. So you have your glutes, you know, like the whole hip complex. You have muscles that are like superficial to the bone structure, so really far away, closer to the skin. But then you also have a lot of tissue that's really close to the bones. Okay, you have small muscles that are really close to the bones, and big muscles that are really far. So the muscle that I wanted to go over today was called the so this is the Piriformis. All right, so I'm going to show you here real quick kind of what is going on here. Okay, so there's a couple of ways we can go after this muscle, and what I wanted to show you today is pretty interesting to me. You know, I think it's pretty it works really well for me. So that's the Piriformis right there. Now, if you look, these two images, one is, let's say the one on the bottom, if you're looking at it, one is in neutral position, hip neutral position, so it'd be like the person is just standing up or laying flat on the ground. And the one on the top is in hip flexion. That's basically bringing the knee up, and it looks like there might be a little bit of adduction to it as well. Okay, so now, what I wanted to hit on was that right there. Putting the hip in flexion and a little bit of adduction, okay, is gonna really expose that piriformis, and it's gonna allow us to really get into those deep hyperflex fibers on it, right? So I'm not saying you can't get after that, you know, after the piriformis when the hip is in neutral, but I'm saying, you know, what I'm trying to get at is that if you put the hip in flexion, as you see there, it's really going to expose that muscle. It's really going to stretch it out a little bit too, and it's going to allow us to get in there a little bit more. So this is just going to want to just hit on this real quick, and I want to show you the tool that I use lately. I've been using kettlebells to really get after these deep tissues, and holy shit. I'm telling you, these kettlebells are amazing. Like, that's the thing, is like you get a lot of success in using things for what they're not necessarily designed for, right? So you think about a kettlebell, you know, it's not really designed, I don't think they really had deep tissue therapy in mind, but I'm telling you, the base. So the thing I like about kettlebells is that the base is heavy, so it allows you to sit on this handle and put a lot of pressure on it and a lot of weight on it, and it will help stabilize itself, right? And it's a smaller point too, so it allows, you know, it gets a lot deeper into those tissues than if you were to use something that's, you know, bigger in circumference, right? So just what I'm going to show you right now is just a way how to get after that piriformis really quick. Okay, so normally, you know, if you ever used a foam roller, I'm sure you've seen someone who, you know, I've seen how they tell you to go like this right here, right? So that's basically, you know, that's what it is by putting your leg, when you do foam rolling and putting your leg in this position right here, what it's doing is stretching that piriformis all the way out, right? So I can feel that stretch right now too, okay? So I can feel it's tight right now when I'm in this position here. It's not the glutes, okay? I feel a little bit of tightness maybe on the high part, the high leg, but for the most part, I feel this tightness nice and deep right inside of my hip, right here, okay? And that's gonna be your piriformis right now. So what I'm gonna show you here is a way to how to get after that and release it, okay? So I'm gonna take the kettlebell, like I said, it's heavy base, okay? And nice, strong pressure point right here. So what we're gonna do, okay, we're gonna support our body weight, okay? We're gonna just lightly, slowly apply and sit on the kettlebell handle here, okay? And then we're gonna bring our leg up, okay? Here, see now, so I'm in that position. Now I have the piriformis stretched out, and what I'm gonna do is I'm gonna think about going to the top of my femur, okay? So we're not necessarily going, you know, towards the ceiling. So what I'm thinking about doing is I'm actually applying pressure this direction here. I'm not trying to focus all the way down, okay, this way, right? What I'm actually trying to do is I'm trying to apply pressure in this direction here, right? So I'm pushing my body this way, and the pressure will be going that way, right? Up into the head of my feet, okay? So I don't know if you can see that or get that, but so then what we're gonna do, we're just gonna hang out on it, okay? And now we found that spot. Oh yeah, there it is right there, okay? So like I said the other day, you know, one way to get a muscle to release, you know, or a few ways is stretching, deep tissue therapy, and also using one muscle to, on the opposite side of the other muscle to help release that. So what we're gonna do now, okay, find that, and we're going to do hip adduction. Oh, we're gonna stretch that, oh yeah. Basically just taking your thigh through the range of motion here. And I'm still applying pressure. I'm pushing my body this way into the head of my femur, okay? So I'm telling you right now, remember, this is not your glute max, glute medius, glute minimus, okay? This is the piriformis, okay? Nice and deep. It's attached to the head of the femur. And actually, you know, this muscle is very, the sciatic nerve actually runs right underneath this muscle here, in between the pelvis and the head of the femur, in a little channel there. So it's really responsible for a lot of sciatic nerve pain. So if you have sciatic nerve pain too, as well, I would recommend doing this here. I would recommend you trying this before you go, well, I mean, obviously go talk to your physician first, but I mean, I don't know, like I'm more of a self-medicated kind of person. I mean, I've been to the doctor a while, but doctors have just messed me up. They've definitely made my life a lot harder for me with my surgeries and all that stuff. So now, you know, I kind of take this own path for my own health here. So anyway, so back pain, sciatic nerve pain, this is a really good area to kind of go after. So, oh yeah, there it is right there. Got another spot. Oh man. So the one thing too with this stuff, like it sucks, it's painful, like oh my gosh, like that is like, whew. So like I said, that the pain side of things, your body has a system to tell you that something's wrong. Like if you push on an area and push on a muscle and you apply pressure to it and it hurts, you know, like to a certain point, you know, like you have to come to a realization like, okay, something's wrong there. You know, your body is trying to tell you something is wrong, something's going on. So go after it. And then now when you go and you sit on something like this, like yes, this hurts. Oh my gosh, you know. But the way I like to kind of, you know, think of it too is like, you know, I've got tattoos. You know what? These tattoos hurt. Okay, they hurt, right? Tattoos do not feel good. Okay, doing deep tissue therapy does not feel good. Okay, back pain doesn't feel good. You know, but if you have back pain and you have sciatic nerve pain, doing something like this for 5 minutes of pain versus, you know, your everyday pain that you have is going to be so much more worth it, right? So like I said, you know, getting a tattoo hurts during doing it, but when the tattoo is done and it's over with, like it's beautiful and it's, you know, like it's what you wanted, you know. So just try and fight through the pain a little bit, and like with the pain too, you know, it helps to breathe, you know, like really breathing, focusing on pushing your, you know, breathing through your nose, pushing the tongue on the roof of your mouth, okay, and keeping your jaw in a neutral position. You know, that's how you want to focus on breathing, and then breathing into your chest cavity and your diaphragm. So cool, man. That's it for today. Have a great Friday, everyone. Bye.